Hello everyone. So in this lecture we are going to discuss about the primary impressions in complete denture or impression making in complete denture. So this is something which comes very first after your diagnosis and treatment planning, right? So once you have diagnosed and planned the necessary treatment plan for the respective patient, the first thing as a prosthodontist or as a dentist, when you are prosthetically rehabilitating the arch, you would require is a primary impression, or it can also be used as a diagnostic impression, right? You can take a primary impression, make a diagnostic cast out of it, right? See whether what are the parameters which are important, and after that you can proceed with your further steps. So this plays as a milestone or a landmark from which you start your clinical treatment or clinical laboratory treatment for prosthetically managing the arch. So starting with the introduction and classification. So the basic introduction what I would give about this is it is a type of complete denture. When we talk about in primary impressions in complete denture, it will be a complete denture impression that can be defined as a negative registration of the entire denture bearing area. So the whole denture bearing area on which your denture is going to get fabricated, that area of the oral cavity which is used to record to make complete denture. Okay, moreover it also records the stabilizing and the border seal areas also which are present in the mouth. Border seal areas means the sulcus areas where our denture borders will be extended. So a complete denture impression can be defined as a negative registration. It is an opposite registration, right? You are taking a negative replica of the entire denture bearing area, the stabilizing area and the border seal areas which are present in the edentulous mouth, right? So now these or this type of impression is usually done following the pre-prosthetic treatment. So in the previous lecture we discussed about the mouth preparation or the pre-prosthetic surgeries, the corrections which are required to be done before you start your prosthetic phase. Okay, so when we do the treatment of a patient where we are replacing the teeth, we divide it as the emergency phase, the surgical phase, right, the pre-prosthetic phase in which endodontic, orthodontic, everything will come, surgical, and then we go with the prosthetic phase and then follow up, right? So whatever the treatments which are necessary, which are compulsory to be done before fabricating a prosthesis is coming under the pre-prosthetic treatment. Now then we move forward with recording the diagnostic impression. So once our pre-prosthetic treatment is over, after that we move on to recording the diagnostic impression. Now if we want to classify the complete denture impressions, firstly depending upon the theories of impression making, there are various theories which are given by different authors or clinicians to justify the impression making in complete denture, right? First is the mucostatic or passive impression theory, right? We'll just discuss the names, we'll see the classification, and then individually we'll discuss these theories separately. Then we have mucocompressive or functional impression theory, then selective pressure impression theory, myostatic impression technique, and dynamic impression technique. This is based on the theories given. Second is based upon the technique, right? When you are asking the patient to keep his or her mouth open, it is an open mouth technique. When you are not asking the patient to keep the mouth open and the patient itself is giving the movements without you not using your hands at all, that is called as a closed mouth technique. Okay, third is hand manipulation for functional movements. Okay, that comes under dynamic impression. Fourth is depending upon the type of tray used, it can be a stock tray or a custom tray. What do we mean by stock tray? Which is there in stock in our clinical setup, the metal trays, okay, which have some numbering of sizes 0, 1, 2, 3, 4, right? It is not customized according to the patient, is a stock tray. When you are taking a primary impression, making a special tray on it, that is a customized tray, because that tray won't fit to any other patient, right? So that is why it is called as a custom made tray or custom tray. Then the purpose of impression making. What is your purpose of impression making? That also can give you types of impression. As I said, diagnostic impression, primary impression, secondary or final impression, or master impression, right? Then next, based on the material used. So when we talk about the materials, we have reversible hydrocolloid, irreversible hydrocolloid, impression compound, impression plaster, which is not used nowadays as much. Then we have used to use wax for taking impressions, silicone impressions, rubber impressions, right? So all the impression materials which were used to take the impression of the dental arches, probably in your complete dentures, can be mentioned over here.